school at Northwest AHEC in collaboration with the Southeast STI Prevention Training Center. I'd like to welcome you to the 2025 North Carolina STI Update. Yes, we made it here in August. So today we're going to go through some really interesting topics, going from your prime years to your golden years and everywhere in between, touching on conversations regarding diagnosis, treatment, and prevention for the care of the populations that we love to serve here in North Carolina. So I'd like to turn it over to our first speaker of the day, Dr. Victoria Mobley. Dr. Mobley has received her undergraduate degree and medical degree from Duke University and a master's degree in epidemiology from the University of North Carolina School of Global Public Health. She completed an internal medicine residency at Johns Hopkins, followed by an infectious disease fellowship at UNC Chapel Hill, and now serves as the HIV/STI Medical Director for the North Carolina Division of Public Health. Welcome, Dr. Mobley.
All right, thank you. I am so sorry, I can't get my camera to work. So I was trying everything else and making sure my audio worked, and the camera situation has eluded me. Can you see my presentation in presentation mode?
Yes.
Okay, good. All right. So this is going to be a brief presentation. I'm just going to give you a quick here. I'll show you. Hang on one second. Let me make sure I can advance my slides. Quick overview of our STI and HIV trends to date. Tell you where we are with congenital syphilis. And then I want to spend hopefully the majority of the time I have here showing you where you can find your own jurisdiction's data, because we have a cool, relatively new feature that I hope you guys have heard about it, but if not, I'm going to show you today. All right, let's jump right into it. So this is chlamydia. I don't know if this is, let me see if I can get this toolbar out of the way. Oh, there it goes. Okay, so we'll start with chlamydia. Any US data I show you, it's only going to be through 2023. So CDC has let us know that their 2024 data will not be finalized until 2026. And so although I will be showing you as up-to-date data as we can for North Carolina, which is through 2024, I will only be showing national trends through 2024 when I have them. All right, so good news about chlamydia. May be on the decline here in North Carolina. You can see we probably need a few more years to make sure this is actually a trend that's going to continue. But if you look at the North Carolina trends for both men and women compared to the national trends, it looks like we may be on a slightly downward bend here. So fingers crossed that continues. Okay. And then for gonorrhea, we're seeing something a little more interesting. And by interesting, I mean a more dramatic decrease in reported infection. So we did some work to make sure that this decrease we're seeing wasn't due to a reporting issue. And we think we've figured that out. And we don't think that there's a reporting issue with the data that we're showing now. But now the question is it a true decrease in morbidity, meaning less gonorrhea out there, or are we seeing a decrease in testing? And that's something that we're still exploring, and would love to hear thoughts from you guys on the ground. If you're still seeing as much gonorrhea as you normally were seeing, or if you think even though testing has remained relatively stable, that you're seeing less infection. All right, so Mpox, we can't get away from that. So from our outbreak in 2022, we did see a dramatic decrease in 2023, but we still have some sporadic cases. And in 2024, it looked like there might be a slight resurgence, particularly among men, which is where this outbreak really hit. And then I will say, although I'm not showing 2025 data, in 2025 through early August, we had 10 cases reported, but half of those cases have been since June. So it's definitely worth remembering Mpox when you're seeing patients in clinic and they have clinically consistent symptoms, and in considering testing those individuals who not only have clinically consistent symptoms, but risk factors. All right, on to HIV. So HIV infection rates, they've been stable for years. And, unfortunately, I will say that that is just disappointing, given all the prevention tools that we have, including PrEP and treatment as prevention, and now doxypep to decrease STIs, which we know can increase your risk of acquiring HIV, as well as post-exposure prophylaxis. All of these tools that we have available, and we still are not making any headway in our HIV infection rates. So really work to be done still. All right, now on the syphilis, which has been kind of our burden to bear nationwide and in North Carolina for the last several years. So the good news is early syphilis rates in men have been decreasing since 2022. So great news. We're really seeing a dent in syphilis reported, particularly infectious syphilis reported since 2022 in men, but we're not seeing the same thing in women. And you can see here, this is all North Carolina data. So the dotted lines are also North Carolina. Primary and secondary. So symptomatic syphilis are the bold bars, and dotted lines are non-primary, non-secondary early syphilis. So still acquired in the last 12 months, but no documented symptoms at the time of diagnosis. And you can see in the purple that for women, there was maybe a slight bend in 2022 for primary and secondary, but really not impressive. And then the non-primary, non-secondary early syphilis cases were still rising. And if you, this next slide, this is late unknown duration syphilis by gender and by partner gender. And for those of you who see patients and test patients a lot for syphilis, you know that individuals can end up in this stage even if they have infectious syphilis, right? So if they don't have a clinically documented symptom of primary or secondary, even if their RPR is 1 to 512, if they don't have that symptom or a negative RPR in the prior 12 months, it's hard, you can't stage them as an early case, even though you know by their titer that they likely are an early case. And you can see here for late unknown duration that it's really bringing home that women have been disproportionately impacted by the syphilis epidemic in the last several years. So women are in red, and they are continuing to go up, or had been continuing to go up at least through 2024 compared to our male population. But I don't want to leave you with just bad news, because there is some good news on the horizon. So this is looking at percent change in reported early syphilis cases between January and May of 2023 through 2025. So each year is comparing to the prior 3-year average for that same time period. And you can see, I circled here for 2025, that we are seeing for the first time in January through May of this year, a negative percent increase for women. So we had already been seeing a negative percent increase for men who report having sex with men. And we had been seeing a decrease in percent change for women and men who have sex with women. But now finally, all 3 groups have a negative percent increase, which I'm going to cross my fingers and put it out there into the universe that I think this might mean we are bending the curve here, and we hopefully will start seeing a decrease in reported syphilis cases among women in particular, but among all of our populations in general. But that is still going to result in a delay in what we're seeing around congenital syphilis. So this is our 40-year trend for congenital syphilis, and you can see the very end here is our 2024 numbers, which have already exceeded the mid-90 surge that we saw, and is on its way towards the high that we had reported back in the 1960s, which we are trying really hard to prevent. But unfortunately, even as the reported syphilis and actual infections in women decrease, there's always going to be a delay in what we see with our congenital syphilis numbers. And we still do our congenital syphilis reviews, and what we're seeing regarding the most commonly missed prevention opportunities are either women who don't enter prenatal care at all, so they show up at the time of delivery having had no prenatal care, or they entered prenatal care late, so either in their late 2nd or 3rd trimester of pregnancy. And then less common, but still a factor, is failure to adhere to North Carolina's public health pregnancy screening rules. So hopefully all of you are aware that in North Carolina, we require all pregnant women, regardless of risk factor, to be screened for syphilis at that first prenatal care visit, whenever it happens, again at 28 to 30 weeks gestation, and again at delivery, all 3 times. And we're still seeing some missed screenings across the board here, including women who enter prenatal care early in their pregnancy. All right, so let's move on to the fun stuff. So all of the data that I showed you, or at least the North Carolina data I showed you, I got from this interactive data dashboard. So again, I hope that you guys have heard about this. If you haven't, I'm going to run through some of the highlights of what you can do with this interactive data dashboard. And I'll also put the link, which is in the bottom here in the chat, so you can play around with it on your breaks. So this is the landing page for the data dashboard. It is up to date through 2024. And you can see here by the description here, it has data from 2015 through 2024. So good 10 years of data. And it allows you to pull your data to meet whatever your data needs are. So you can pull by county, you can create maps and look for trends, you can pull by region. So if you want to see your county and all the counties around you, if you want to see statewide data, you can look by demographic. So let me show you what that looks like. So on the right here are the various groups that you can use to pull data specific to your needs. So there's a demographic group here. You can pull the data for everyone, or you can do it by age group, ethnicity, gender, race. They have multiple years. If you want to look at all the years, you can, or if you just want to look at specific years, you can do that as well. You can select the ones you want. All the counties for North Carolina are included in here. So again, you can do all, which will give you statewide data, or you can just choose the counties that you want to pull the data for. Over here is disease group. And again, I'm showing you STI data because we're at the STI update, but all reportable communicable diseases are in this data dashboard. So if you're a communicable disease nurse part of the time, and you want to look at foodborne, or you want to look at respiratory infections, you can choose the group you want, and then you can go even deeper and just choose that specific infection or disease that you want. So it allows for a lot of mixing and matching. On the left here, I ran it for multiple years. So I chose both 2023 and 2024. I chose all the counties because I was interested in looking statewide. I did choose the sexually transmitted disease group. And then I chose within that, all of the STIs that are reportable in North Carolina. And you can see it's spitting out the numbers, the case counts, and the county incidence rates for each county. And you just see the clip of the A's because obviously they're first in the alphabet. And so what about if you want to just create your own table? So if you want to create it by demographic, jurisdiction, and one or more diseases. So I did that as well. So this, I just chose Wake because I live in Wake County. I wanted to look at the data by gender. I wanted to compare 2 years. So again, 2023 and 2024. And then again, I chose all of and I didn't have to, but I chose to choose all of the reportable STIs. And again, so this is Wake County's all reportable STIs, case counts, and county incidence rates. And so this is a really helpful tool if you're wanting to know what's happening in your jurisdiction. It's relatively up to date, right? So I don't know that we've actually even published our 2024 surveillance data yet. It's coming, but it's already in this interactive data dashboard. And so you can run your own jurisdictional data. And then one last feature that I want to make sure I show is that it can actually help you generate presentation slides. So this one here, I wanted to look at the data for just secondary syphilis by race for the year 2024. And you can see it's showing females in gray, males in orange. And then I wanted it to create a slide for me that I could just stick into my PowerPoint. And so I had it export the slide. This one actually is in PowerPoint, not PDF like this highlighted, but you can choose. So you can export it as an image, you can export it as a PDF or a PowerPoint, and then it's just ready to go to stick into whatever presentation you are wanting to use it for. So again, there's a lot of ways to use this interactive data dashboard. If you have questions, please feel free to reach out to me or actually my colleagues who are responsible for Dr. Erica Samoff and her team are more than happy to help you navigate through this dashboard if you have any issues. But please certainly play around with it and see what's available, because it's a really great tool if you're looking for data. All right, I think that is it for me. Yeah. So let me stop sharing, and then I'm gonna turn it back over to Dr. McNeil to introduce our first speaker. But I'm going to introduce Dr. McNeil first, who is not only our one of our coordinators for this and moderator for this update, but also will be one of our speakers later today. So those of you who are at the Communicable Disease Branch Conference know that I love a good AI-generated introduction. So I'm going to read you the AI-generated introduction for Dr. McNeil. So Dr. Candice McNeil is an associate professor of infectious diseases at Wake Forest University School of Medicine, where she fights germs with science and style. She trained at Stanford, survived the Bay Area traffic, which is no feat in and of itself, and brought her public health expertise to North Carolina. Dr. McNeil serves as a consultant medical director for Guilford and Forsyth County Health Departments and the co-medical director for the CDC-funded Southeast STI and HIV Prevention and Training Center. She's a subject matter expert for the CDC's STI prevention guidelines because someone has to make sure those facts are straight. She's triple board certified, so can you say overachiever, in internal medicine, pediatrics, and infectious diseases. She's basically a one-woman medical Avengers team. Her work focuses on public health, STI education, disease management, and prevention with a side of mentorship and community impact. When not tackling infectious diseases, she's probably giving a talk, writing a paper, or explaining why prevention is cooler than cure. All right. Thank you all, and welcome, Dr. McNeil.
Thank you, Dr. Mobley, and I appreciate the humor this morning. And also thank you for introducing STIs by the numbers for the state of North Carolina. It's always good to know where you are and to be aware of this innovative tool that's available for us to keep track of what's going on. All right, so before we go into our next speaker, I'm actually going to go ahead and test out our polling features. So I'm going to ask our admin team on the back end and support team, Andrew, can you pull up our first poll? Okay, so let's go ahead and enter some answers here. I would really like to know who we have out there in our very large audience.
We have responses just flying in, so just let us know when you want us to stop the poll.
Okay. I think we're good to stop the poll.
Let it run like 30 more seconds.
Okay.
Get up to 700 here. Flying in. Public sector's leading by a long ways. Can the private sector catch up or no? All right, get your answers in. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. All right.
Okay, Andrew, there we go. So these are our poll results. And Andrew, as you suggested, the public sector is largely represented in our meeting today. We also have some representation from our private sector, likely our academic institutions and other folks out there. Thank you so much for joining us today. In terms of our provider profile, we have a mostly nurse-driven audience. They are the base and the ground of public health. Thank you for showing up today. We also have some nurse practitioners, PAs, some physicians, and some public health workers, pharmacists, and disease interventionists to help us get the job done. So as you can see, in terms of the CDC prevention guidelines, it seems like a lot of people are aware of them. That's great. That's going to come in handy for today's updates. And then in terms of other questions that we have listed out here, just for baseline knowledge, does your organization have a DoxyPEP program in place or prescribed DoxyPEP? We see that it's about 50-50 maybe. For those not prescribing, what are the barriers to implementing? We see that there are a number of them that are out here. Like, what is DoxyPEP in the first place? I'm already too busy doing stuff, you know. Fear of what's going on regarding drug resistance, and it's not currently, we currently offer at our site. So we have many opportunities for education and learning, and I'm really glad we have a number of learners from different backgrounds here today for this talk. All right, we can close that poll out. And so it is with great pleasure that I now introduce our next speaker. Is Dr. Shannon Dowler here? Did you get through the traffic today in our speaker?
She's there.
Okay, excellent. So Dr. Shannon Dowler is a family physician certified in executive and healthcare consultant with a flair for infectious enthusiasm and infectious diseases of the sexual kind, that is. She serves on the board of directors for the American Academy of Family Physicians. She's an STI consultant and a deputy medical director for Mecklenburg County Department of Public Health. Dr. Dowler is an adjunct associate professor at UNC and a frequent speaker on talks about sexual health across the country. Also known as RAP DKTAD, hope I got that right. I think she has a mixtape out there. No, actually there's a website. Please check her out at some point in time. She is going to be she also has some credits in authorship for a book, Never Too Late, Your Guide to Safer Sex After 60. Clinically, she provides care in Western North Carolina. She teaches English as a second language when she's not wrangling goats, chickens, and barn cats. I hope I haven't missed any animals in that. Dr. Dowler, I thank you so much for showing up today. As you can tell, that's one of our AI-generated introductions, actually with a lot of flair that Dr. Dowler provided for her own bio today. So welcome, Dr. Dowler. We're really excited to hear your talk today.
Awesome. Thank you so much. And just as an update, I had to separate from Mecklenburg a few months ago. So sadly, I am not still working with that amazing team down there. After Helene, the traffic getting from the way distant mountains of North Carolina into Charlotte became a little more than I could handle. But it was a real pleasure to work with that superstar team in Mecklenburg over the last year. So I'm going to try to share my screen. Let's see what happens. You never know in these situations. I'm going to try to share it in such a way. Uh-oh. It's not letting me share it. Hosts with sound or video sharing. So I might need the host to do something to my settings. When we did our little practice session, it all worked.
Let's try this. I just upgraded you to co-host, so see if that helps.
All right, let me close it and do it again. There's always something, right? With these, I was going to say, I'm so excited to be here today, but the only thing that would be more exciting is if I was in a room with all of you. That would be so amazing. That is not working either. Let's see if it'll, nope. Okay, well, I don't have to share my videos. Let's see. They're available.
Sorry, Andrew, are you able to cue her videos when needed on your end to share?
They're embedded in my presentation. So
yeah.
Can you do that? Okay.
We have a copy of your presentation. We can cue them for, just let us know.
Perfect.
Also, real quick, Dr. Dowler, Andrew, she's not currently a co-host. I know that you said that you were going to try that, but I don't see it as her being listed as a co-host, and that might solve the issue.
Yeah.
There we go. Now see if you have the...
Oh, look, that's already looking, well, no. but it's letting me at least see my screen now. It wasn't even letting me see my screen. Still won't let me do video or sound, but it'll let me share my screen. So that's exciting. Let's move this over. Are you guys able to see the PowerPoint?
Yes, we see it.
All right. Is it in the right format? Do you see the right, just one slide, not two split slides?
Yep, all
Perfect.
good.
All right, yay. Well, I am so glad to be here. I'm actually in RTI for a meeting on maternal and infant health disparities with a state organization that I'm participating with. And so I broke away from that meeting to come talk to you guys about my very favorite topic, which is, of course, STIs, and particularly talking about STIs in the older years. Just in case you're wondering where this amazing picture came from, one of my good buddies from Girl Scouts back in the day and I were hanging out well, it was back in February. We had a girls' weekend. And I came in and I said, I brought the kava. And she goes, I brought watercolors. So we sat together, drank a little bubbly, and painted STIs. It was really lots of fun. So that's where this renderings of STIs come from. What I want to do with you today is I want to share some of the data on STIs in the older population, just to get it on your radar in case it's not on your radar. I want to help you process it, right? Like sometimes it's hard to think about grandma and grandpa doing things. So we're going to talk about it. What's happening in the world of sexuality in the older population? What are some of the risks that they're experiencing that are different? What are some of the benefits they're experiencing that are different? And then I'm going to motivate you to get on it because I don't think we're doing a great job probably in healthcare overall. Now, I know all of you guys in STI clinics, like you guys are killing it, right? You're asking all the hard questions. But I don't know that that's true across the house of medicine. All right, so this is a picture of a couple of my amazing goats. And I have 2 new baby goats, so I'm now a 6 goat mama. They're all named after STI treatments, of course, because like what else? So I'll show you another picture of them. But the point of this slide is I know we're supposed to say STI now. I'm very, very old. And sometimes I'm going to say STD. So I'm sorry if I accidentally slip in an STD instead of an STI. I know STI won, but it's just hard. Old dogs, new tricks. All right, so is it really an issue? Well, I will say if you just Google the headlines about old people having sex, it is definitely an issue. We are seeing really interesting headlines where people are paying attention to our seniors and our senior sexuality, including the Golden Bachelor, right? So everybody is interested in this population in their sexuality. As a matter of fact, when I did my rap video around STIs in the older population, which hopefully we're going to listen to as a just break in the monotony of my voice, what was interesting is it got this kind of wild bipartisan repost and commentary. So on the same day, Breitbart linked to it, Mashable linked to it. So it's really interesting. Like everybody, this is one thing we can get along about is that we're interested in this topic. So is there a story here? That is the question. We're going to go through some data, but first we're going to try to watch this video and see if it works. Do you want to try to share it from the background since it wouldn't let me share sound?
Yeah, I'm trying to pull it up right now. My computer's just going a little bit slow this morning.
Yeah, if you can access my slide deck, like as I'm sharing it, you can just click on the play button, but if you can't, we'll skip it and people will have it in their decks. I assume we're sharing our slides.
Yes, we're sharing the slides. And no, it doesn't allow me to click directly on your slides.
Okay.
Andrew, does it allow you?
I'm looking for it. I got it now. I can share it if you'd like. Let me get it sharing. So let's see. Let's see here. Share sound. My options are, let's see here. Why are my share sound options are not included either?
Yeah, well, we'll skip it. Don't worry about it. Although there are a couple of videos in here that I really wanted to show you guys, but you'll get it in your deck and it'll be fine. So let's look at the data, because the data really tells a good story. And so why did I start thinking about this? You might be wondering, like, why is she thinking about this in the first place? I was noticing at the time I was at the Buncombe County Health Department, where I spent many, many years in their STD clinic. I was noticing that the average age, the demographic of who was coming in the door was really different. It's just like overnight, I suddenly started seeing as many 60-year-olds as 20-year-olds. And it was just like, this is interesting and different. And then it was one day I was in there and this guy comes dragging in his oxygen tank with a herpes outbreak. And I thought, this is definitely different. So I loved that we were seeing a change. And that's when I started looking into it a little more and diving into it. So let's see. Oh, look. Oh, no. There we go. So this is from the amazing CDC Atlas where you can get access to all of their sexy data. I got to say, now that I know Vicky's got sexy data and Erica online for North Carolina, I don't know why I'd email them again, because I'm always stalking them for the latest data set. And now I'll just have to go find it myself. But this looks at, so you can break it down, much like in the North Carolina version, you can break it down by ages. And so this is looking at the 55 to 64 population across the country and looking at primary and secondary syphilis. And what I'll call attention to is that slope rise that we're seeing across all ages, actually. So it's also happening in that 55 to 64 range. When you look at who is getting syphilis as an older adult right now, white far exceeds black in that. And so there's some interesting differences you'll see in the older population of who's getting the STIs. Now, here's the question. Is it because the other folks don't have the STIs, or because we are not checking for them? And I think we have to ask ourselves that question. When you look at the male to female breakdown, this is, of course, follows right along with the other patterns we've seen, that historically the fellas have been the ones bringing syphilis in. And in fact, most of the older adults I see with syphilis have been older gentlemen. So then you're asking yourself, okay, well, so who has a lot of STIs in the older population? And is it just because they live in a state where there's like a whole bunch of old people? And it's like, of course they have more STIs in their older population. So besides the fact that there's a change in the trend, that we're seeing increasing numbers consistently, I wanted you to see, because we're thinking about North Carolina, right? North Carolina is not in the top 10 of the oldest population. So we're pink, but we're not in the deeper colors of pink into purple. But you're going to see that we are leaders in older adults in sexually transmitted infections. And I mean, I would expect nothing less out of us. So when you break it down by which states have the most primary and secondary syphilis in the 55 to 64 range, you see North Carolina is number 5. So like, we are showing up. Good on our seniors. This is the 65 plus. So the last one was 55 to 64. You might relate to that demographic and be like, that's not old. This is a 65 plus. So this is everybody else over 65. And in that demographic, we see that males exceed females. And then primary and secondary syphilis, look at those rates. Like, that's an even steeper increase in numbers. Now, are these the big numbers? I mean, is this really what's driving our sexually transmitted infections around the world? No, obviously not. Like, our young adults still bring home the bacon. But these older adults are having more infections, and there's just a change in the pattern of what we're seeing. Again, interesting when you look at race, that the white or significantly lead the others. And is it because they're the only people having unprotected sex? I don't think so. I think we're just doing a better job of testing. So then when we look at the 65 plus and where does North Carolina fall? We drop one spot, but we are definitely still in the top 10. So even though we're not the oldest state, we still are winning the race when it comes to syphilis in older adults. Okay, so does the trend play out in other infections? Well, spoiler alert, yes. So gonorrhea in the 55 plus, again, you see this increase over the last decade. Again, the boys are winning out over the girls on these gonorrhea infections. Again, you see that the racial demographics are holding steady. And then this is looking at where the states are, and we are again number 5. So it's not just syphilis, we are leaders in gonorrhea as well. Then this is our 65 plus. So yep, the pattern is holding true in our 65 plus crowd as well. Same pattern of the guys winning the gonorrhea race, same pattern from a race standpoint. And then North Carolina, even in the 65 plus for gonorrhea, continues to be a leader in the country. All right, so then what about chlamydia? Chlamydia also seeing increasing rates over time. I could tell you so many stories, and several of them are in my book. So, spoiler alert, get the audio version. It's actually sidebar. I had to audition to read my book. So the publisher said, hey, they want to pick up your audio book. And I'm like, oh, that's great. When do I record? And they're like, oh, no, you don't get to record your book. I was like, what? No one is going to say these words. Like I'm the only one that can read this book. So I had to audition as myself, to be cast as myself to read my book. All right, so here's something we see a little different in that 55 plus crowd for chlamydia. We start seeing the ladies showing up a little bit more. And that makes a lot of sense based on our other trends with chlamydia infection. And actually several of the cases I've seen in the older population with chlamydia have been tied to sex toy sharing more than intimate partners, which is interesting. So again, we're seeing a lot more in the white population. When we look at 65 plus, they as well are having more of the increases in the chlamydia, and the ladies are winning that race compared to the other infections as well. White, once again, that persists. Now in chlamydia, North Carolina is a little bit lower. We're still a top 10 state. So no one's saying we're not getting those infections, but we're not doing quite as, we're not showing up quite as strongly as we are in the gonorrhea and the syphilis space. Now, what about HIV? Vicki talked about this in her early data. Like really, guys, we should be seeing the HIV diagnoses going way, way down at this point. We have all the ways that we can make HIV not happen, and yet we're stagnating. And so we are also seeing that pattern in our older adults as well. So yeah, they're not knocking it out of the charts with new HIV infections, but they're not getting better. And that feels very problematic to me. So then this is again the 55 to 64. You start seeing the Black population creeping up here, as well as the Latino population. When we look at where North Carolina falls, we're further down the list in the HIV as far as states that are struggling with this in older adults. And then we get to the 65 plus. What? Who wants to be 65 plus and get diagnosed with HIV? So we're actually seeing a trend of increasing rates in the 65 plus with new infections. In North Carolina, we're a little higher in this when you compare us to other states. So just for kicks and giggles, let's look at hepatitis C. Yep, same pattern. That's true across the 55 to 64 and the 65 plus. Let's look at hepatitis B. It's kind of all over the place, but definitely going up the last few years. And then in the 65 plus, clearly showing that pattern. And so I hope the data tells the story that I clinically have seen in my clinic, this shift from, like, I remember back in the day when it was all like teenagers and college kids that we were seeing. I mean, that was the vast majority of who was coming in. And of course, most of them had genital warts. But now that shift has really changed, and we're seeing our older adults come into the clinics. So why? What's happening? What's different about the world and the universe? I think there are a lot of different shifts, both from cultural, societal, and physically, that are important to highlight. Before I tell you that, this bull on a porch, this is about 2 miles from my house. I live way up in the middle of nowhere in Madison County, and I get to drive past this house on a regular basis, and you never know what species will be on the porch. Sometimes there are like 4 different species, if it's a rainy day, huddled together, hanging out on the porch, and then you can see the shadows of other ones inside the house. I don't know how these bulls get in and out of the house with those big horns, but somehow they do it. So if you ever come visit me, you got to watch out for this porch. It gives me tremendous joy. All right, so I propose that there are a whole bunch of different factors that are just happening at the same time that are driving these increased rates of STIs in our older population. And each one of them by itself could probably account for some increases. And I think when you just put them all together, it's just the right time to have more infections. The one thing I think we all have to say is these are our baby boomers, right? These are the folks that taught us about free love and opened up sexuality for us as an entire country. back in the 60s, and they're retiring, and they're retiring in group living environments. So you think back to your college days, and like you still had to study, right? And take tests. Most of us had to work in college, but people still had time for sex. Well, when you get into this retirement space, if you're living in a retirement community, you're financially sound, you're probably not working, you're probably not taking tests and going to classes. I mean, like, why not? So I think this is the group that taught us about sexuality and sexuality differently in this country, and now they're retiring. And so we should not be surprised that we're seeing a different pattern as they age. One of the things that I think is a big driving factor for this is also what we see in our younger adults, which is the hookup apps and using dating apps and hookup apps. There are so many. If you go out and do a Google search on hookup apps for old people, like there are all these articles about which ones are the best ones, which are the most reliable ones. A lot of our seniors have moved into the technology space, and sometimes they're using them for very, very positive things like having friendships. Maybe they're widowed and they need someone to have dinner with sometimes. They've moved to a new community, and making friends at a certain age is just harder than it was when you had, you could bond over your little kids playing in the playground. So there's a lot of real benefits to these dating apps and these hookup apps. But we also run into the same challenges with them, that suddenly there's just no boundaries. So when people travel and they go other places, it becomes very difficult to track partners. It's also a huge amount of anonymity involved in these apps. So it's easier to find partners. It's harder to track partners. It just adds to the complicating factors of this. I would say,
Dr. Dowler, one second.
yes.
Could you, so before we were able to hear and see your previous video whenever you clicked through it. So I'm wondering if, even though it doesn't have that box for you to check like it did during our practice session, if you could try to play this video, and then I'll let you know if I can hear it.
That's great. Yeah.
Okay.
Yeah, so I found this, it's an old, so one of the challenges I'll say is that a lot of our seniors, if they even had a sex ed class, it was probably something like this. And I'm just going to play a few seconds of it because it just makes me laugh. This is sex ed curriculum in the 60s. Lindsay, can you hear it?
I can't.
Animals pair off.
Oh, now I can. Now I can.
Links in the endless chain of life. And when the newborn arrive, they are nursed by their mothers, looked after only until they are able to forage for themselves in the elemental world in which they live. Social, psychological, and emotional needs and desires unique to human beings have given rise to many customs of courtship and marriage, which known.
All right, I'm going to stop it there. You guys can see it if you want to get into the deck. It's very funny, but this is sort of the sex ed that they had. And so if they had sex ed at all, it was probably not the sex ed they need for today's sexual activity, let's be honest. And so a lot of folks that are older adults, maybe they're coming into a new relationship for the first time because their partner has passed on. Maybe they've been monogamous for 50 years and suddenly they're not anymore. Or maybe they're living in an environment where they're having key parties and they're like swinging. I've seen it all. Whatever that is, their education that got them to today is probably not as strong. And so I do talks for senior groups periodically. I just did one for my mom's retirement community up in Asheville, and it was hysterical. I just have the most fun doing sex ed talks for this group because they're just not afraid to say anything. And they're also the first ones to admit that they have no idea what's going on out there. So lack of education is part of the challenge. Another game I like to do when I do my talks to seniors, so for those of you that are health educators that get out into the world and do health education, I do a game where I say, I bet you can't name all the sexually transmitted infections. And I do this with doctors groups too. No one's ever made it, I gotta say. The closest I've ever gotten was I did a talk for Montana Academy of Family Physicians a couple months ago. I went out to Montana and they did very, very well. I mean, Montana. So I do this game and then I get them to name all the things that they know of that could be transmitted in a sexual way. And then they have like 3 things or 4 things. And then I show them this list and they all gasp and wonder. And then, whoa, my God, who's been reading the headlines about bacterial vaginosis that we might actually finally get guidance to treat partners. We'll see. I was texting with my buddies at the CDC asking if they were going to do something, and everyone's very non-committal right now. But there are a lot of infections out there. Another game I like to play with them is sort of the pin the tail on the donkey game, where I say, I bet you can't name all the places where you can get a sexually transmitted infection. This really got some thinking. And if I do it in person, I'll actually have them come up and write on the big post-it paper. But if you do it virtually, this is a fun way to do it too, just to get them thinking about the fact that we actually have to test all the parts that are exposed. And we're not great about that with young adults. I mean, truthfully, I've seen a lot of people that have come into our clinic who are on PrEP, but their PrEP provider's not been swabbing the decks and testing them on the parts of exposure. We're really bad at this in the older population. So another thing to be thinking about. Okay, I promised that I would share my goat names. They are Moxie, Doxy, Zithro, and Metro. And then I recently acquired 2 new babies. Little twins. Their mama rejected them, so we got bottle-fed baby goats, and they're Benny and Penny for benzathine penicillin, which is of course on everybody's mind because once again we're hitting a shortage place, which you would think we were past it, but apparently they had to do a massive recall on a lot of lots. And I'm curious if folks out there, just out of one of my other side hustles, is doing some national work around syphilis. A few comments in the chat if you guys are having trouble accessing. I'm just curious because we're hearing it's not such a big deal, which doesn't feel right to me. As an aside, the room I'm in just turned off the lights. Just as an aside, lenticillin and extensilin are still available. Okay. So why else are older adults more sexually active? Well, I think there's some things that we've done differently currently. So we have better living through pharmaceuticals, right? We can do better with erectile dysfunction, vaginal atrophy, some of the things that kept people from being sexually active later in life. There's also like a lot of other devices and things that people can use to improve their genital health as they get older. We're getting better at producing non-hormonal solutions to increase comfort. So a lot of the historical treatments for vaginal atrophy was estrogen-based, and then of course breast cancer. And then even though the data and the studies are supportive that topical vaginal estrogen is safe, if you're a breast cancer survivor, a lot of people are still not going to feel comfortable with that. And depending on their physician's comfort with it, they may or may not be endorsing it. So there are more non-hormonal solutions to increase comfort with sex with aging. And then, of course, as I mentioned before, we have these opportunities for emotional and physical connection through our hookup apps and our dating apps and our community living. I read somewhere that we have over 20,000 retirement communities. I'm not talking nursing homes. These are just retirement communities, the 55 plus communities in the country right now. It's a huge shift on how people are aging and where they live. And then also there are these vulnerabilities with aging. So we know that immune function diminishes. Vaccines are less effective as we get older, and you're more susceptible to infection. We've got our skin thins and we lose that elasticity. So there's microtrauma with vaginal dryness, but even penile microtrauma from penetration can happen, which creates these openings for infections to come in. One of the things a lot of people don't think about is one of the challenges with aging and sexuality is orthopedic challenges. So people's ability to be sexually active in the way that they were before changes, and the types of sex they have might change. I have a friend of mine that has a specialty in fetishes. And when I was writing the book, I was asking her about, what she has seen. And she said the main thing she's seen with fetishes is that people that had certain sexual identities had to really dramatically change them when they got older, because maybe they were no longer able to kneel on the floor or to do the things that they used to do before. And that really got me sort of thinking about how that can impact people's sexuality. We have our first generation of people that are aging with HIV. And by that, I mean aging into a long life with HIV. And so we don't know what that's going to mean yet. We're starting to get ideas of what that means. There are questions around chronic disease and the impact on, heart health and other complications. Is there a link with dementia being worse? There are all these questions, we have this opportunity to learn a lot right now, but we're not sure what's going to happen with this first generation that's aging with HIV. And over half the people living with HIV are over 50 now, probably over 55 at this point. So we have this aging population with HIV. Then, of course, we have the long-term impacts of chronic STIs that are emerging. I'm going to talk a little bit more about that. And then the challenge of what do you do with polypharmacy? So it is hard when you get somebody that comes into your clinic and they're lit up with a bunch of different infections, and you're looking at their med list, and all of a sudden you're like, whoa, this is not easy anymore. I got to figure out which of these antibiotics they can take with these medicines. So there's just some of the things that you have to think about as a clinician, taking care of the older population, really understanding what their drug list is and where their drug interactions, if you need to hold medicines. If you do hold medicines, what are the risks for the person for holding the medicines? It does add some complicating factors. So I'm going to share some testing and prevention strategies that I think you can share in your practice. All these pictures, by the way, you would recognize if you had seen the video at the beginning. These are the ladies. That's my mom and my aunt and a couple family friends who are actors in the video. Let's see. So PrEP. We should be thinking about PrEP in our older adults. I mean, there should not be a 70-year-old with their first HIV infection. So if you have an older population that's at risk, you should be thinking about PrEP for them. Now, of course, you have to think about the drug interactions and other things. So it's not as easy of a conversation. Kidney function, like all these aspects of PrEP are a little more intense, but it should be a conversation you're having and thinking about. And then I will say Medicare covers it. So if you weren't sure, I pulled it up to be sure that Medicare does cover PrEP. My mom was going to a party and it was a wear a crazy hat party. And so she came over to my house before the party and we blinged out this old hat I had with a bunch of condoms. And she thought it was going to be very funny. And the people at the party did not understand. It's hard to be part of our.
Dr.
Yes.
Dowler, at the end, could we try to play the video again that you had at the beginning?
Yeah. Yep. And I've got
Okay.
another one between two. We'll pull up and see if we can do it as I go through.
Okay. And the audio is just a little bit low on the video. So if you could turn it all the way up on your computer, then I think it might sound better.
Okay. Perfect.
Okay. Perfect.
So I was surprised at that survey, Cand, I said at the very beginning around DoxyPep and how few of you are using DoxyPep routinely in your clinic. And so we really need to be thinking about this. This is a huge opportunity to prevent infections that are going to make somebody more vulnerable to an HIV infection. I mean, there are all the reasons why we need to be thinking about DoxyPep. And we also need to be thinking about it in our older population as well, particularly if you're taking care of folks who endorse that they're swinging or they're using hookup apps for random hookups when they travel, or they have that cruise ship trip. I've had several couples come in and they're like, look, we give each other a free pass once a year. We go on a cruise and whatever happens, happens, and nobody asks questions and no one gets mad. There is a role for DoxyPep in this older population as well. There are some great slides that the CDC put out last year to help you get through it. It's really very easy to do. And it's actually very easy to operationalize in your clinic. I'm sure our friends at Mecklenburg would be happy to share all the work we did in patient education and all the different resources to how you might want to embed this into your clinical practice. All right, one of my favorite jokes ever. I've started a whole line of greeting cards with sexually transmitted infection themes, which of course nobody likes but me. And it's what's worse than lobsters on your piano, crabs on your organ. The older folks love that one. Okay, so what about vaccines? What about vaccines in our older adults? Vaccines are a tremendous opportunity at preventing infection. Well, sad news. The only one that's really endorsed in the older population is hepatitis B for sexually transmitted infections. And that is unfortunate. But the fact is that the FDA, to get through FDA approval for a vaccine to go to a different age group, the amount of studies you have to do and the intensity and the financial commitment of that company to do that is hard to even articulate. And so as we know, vaccines are less effective with age. The older adults have historically not had as many of the sexually transmitted infections with age. So it is not unreasonable that vaccine producers aren't thinking about our older adults when it comes to vaccines and sexually transmitted infections. But what I will say is, like, where have all the genital warts gone? Any of you that are old school like me and have been around for 20 years doing this work, we used to see people all the time, like week after week, after month, and they wouldn't quit smoking, and you get rid of their warts and then they'd come back. I mean, it was a good way to get to know people. Like that just doesn't happen in clinic anymore. It's so amazing how few genital warts we're seeing. I was hiking in Arizona last year, and I sort of was hiking along this really cool trail, and they had all these cactuses, and I suddenly had one of those aha moments where you're like, oh my gosh, look at that. And it's like the old school genital warts and the new age HPV was showing up on the mountainside. You might not be able to see it. I could see it. So what we're seeing now in the older population that we have to have in our paradigm as we're thinking about this as clinicians is that we're seeing a lot of these HPV associated head and neck cancers happening in our older adults. And that can create a tremendous amount of anxiety for them, because if they go out and do a Google search, they're going to think that they've got a new sexually transmitted infection, as opposed to this being from an infection that happened a long, long time ago. I get asked this all the time. I actually had good family friends who called because the husband got a tonsillar cancer and it was HPV. And she called me and she said, is he cheating on me? Like, do I leave him? How do I handle this? And so I had to explain the whole process of HPV. But we are seeing in the 50s plus crowd a tremendous rise in head and neck cancers that are associated with HPV infection. And so I think it's an important thing to keep on the radar. I know that when you're doing your education with patients, that this might pop up if it hasn't already. Okay, that's Zithro. That's the cutest goat ever. When I meditate, I go out, I have a little meditation platform for yoga and meditation in the goat pen. And Zithro always curls up in my lap and just chooses cud while I meditate. It's lovely. All right, we're gonna try this video. And we'll see if this one works. It may or may not. Grandma got infected with a virus, having sex with Fred on Christmas Eve. You may think there's no such thing as herpes, but as for Fred and Grandma, they believe. She'd been swiping right all day long, and we begged her not to go. But she was itching for some loving, so she took that random fella for a row. When we saw her New Year's morning, she was moaning in the fire. She said her bottom was a-blazing, and that Fred, he sure did dampen her desire. Grandma got infected with a virus, having sex with Fred on Christmas Eve. You may think there's no such thing as herpes, but as for Fred and Grandma, they believe. All right, I don't know if that came through okay, but that was an inspiration driving home from church last winter on a really snowy day. I don't know why these things happen to me. So I went right home. I told my husband I was going upstairs to record a new video. And I did. Let's get past it. All right. And so I think it's important to talk about some of the emerging issues, and I wanted to share with you some of the things that I'm watching and thinking about right now. I've read several articles recently looking at the herpes infection and the linkage to dementia. And so I think that's very interesting, and there's more and more coming out about that. And what does that mean? Like, how should we be thinking about that? Should we be doing more suppressive therapy with people with a history of herpes? Like, none of those guidelines are out at this point in time, but it's one of the things I'm paying attention to and listening to and reading when I see the articles coming out. I already mentioned this whole concept around aging with HIV disease progression and monitoring, and what does it mean, and what's going to happen with our older adults that have been living with HIV for a very long time. And I think it's just I think it's something we need to spend a lot of money on from a research standpoint and monitoring and surveillance. And then we as clinicians are going to need to get updated on what to do. Of course, I'm very interested in this whole topic of bacterial vaginosis as an STI. Like I saw, in the audience response question around DoxyPep and who was doing DoxyPep and who wasn't. I do think we have to watch what's going to happen with antimicrobial resistance in the world of DoxyPep. I think the cynic in me is like, oh, this could be bad because, you know, I'm now in a Lyme endemic place and I get tick bites like every other day where I live. And I need Doxy to work. At the other side of this is like my niece is on Doxy every day for her acne and has been for years, right? So using Doxy for a lot of things that you might think of as being elective. And so people might think treating acne is elective, preventing STIs as elective. I think that I think right now it is better to provide it than not to. But I do think we have to monitor it and pay attention to it. And then, of course, what everybody's wondering is maybe not the Golden Bachelor, but what's the next reality show? A friend of mine's a producer out in LA, and she's been pitching a reality show where we go out to retirement communities and offer STI screening testing with the folks there and then follow them through their results and discussing the results, which weirdly enough, everybody thinks is a really fun idea, but nobody wants to pay for. So, but what is the next reality show? It's going to show up somewhere. And then what can you do today? So this is sort of my final comments, and then we'll open it up for some discussion or questions and answers. You know, it's particularly in a primary care setting, we can be very lazy. So we can have our medical assistant, or if you're lucky enough to have a nurse room the patient, ask all the sensitive questions. And what we know is that doesn't really work when we're talking about certain topics. And so we as the clinicians that are in the room doing that, having that trusted relationship as a healthcare provider, we have to ask the hard questions, even when they make us uncomfortable sometimes. And again, less in these STD clinics that many of us work in, that we're like not afraid of anything, but thinking about how we can get the whole landscape of medical care to be more open to asking the harder questions. Make sure, as always, with everything, that your questions are open-ended and inviting and that you're not being judgmental in your comments. Offer to test for STIs routinely in all sites of exposure. Many of, especially these older adults, they tend to be more reserved when they're talking about this. Many of them have never had a sexually transmitted infection in their lives, and they're kind of freaked out. Make sure that you're asking them specifically what places have been exposed, because they're probably not going to offer it up to you. Don't be ageist. We're so ageist in our society, and people just assume you get to a certain age and you're not going to be sexually active, or that you're going to be monogamous, and maybe because you're married, you're only going to be having sex with that person. So we have to be open to all ages. And we have to not assume monogamy, heterosexuality, gender identity, all those things, just like with our 20-year-olds, right? We don't make assumptions with the 20 to 30-year-olds, and we're more likely to make assumptions with our older adults. And then sex ed. Remember, this group has not had good sex ed. They like saw animals frolicking in fields and watched people getting married as they talked about their sex ed. So you need to be the one to help talk to them about things like sex toy hygiene. I had a woman that came in that she'd gone on a trip with another couple. Her husband and her went on this trip with another couple. One of them knocked on her door and said, "Hey, I forgot my vibrator. Can I borrow yours?" She said, "Sure. I mean, what are friends for, right?" Well, they both came in with, an infection. So, sex toy hygiene is actually a really important thing to talk about. Barrier methods. This older population thought of condoms as a way you prevent pregnancy. They weren't thinking about it as an STI prevention tool. So really talking to them about barrier methods and how they might be useful and appropriate for them. And then, of course, our prevention, like what can you do from a PrEP, DoxyPEP, what are the things you can do to help them prevent undesired infections? And really, I just think we should all talk about it more. So this was at my house. We had a dinner party. We have this group that gets together called the Mad Coast Supper Club. And I was getting ready to do my first book reading. And I made them after dinner sit around in stuffed bags full of condoms and lubricants. And it was very, very fun. We don't talk about it enough. We should talk about it more. And we should talk about it like at the dining room table. So that's all I got to say about that. Lindsay, do you want to try to go back and show that video at the beginning, or do you?
Yeah, let's give it a shot, because the other video that you just played, that sounded perfect on my end.
It came through? Okay.
Yes.
All right. without unsharing and sharing again, I'm just going to do it this way.
Dr. Dowler, after that, we do have a couple questions in the chat that I will read out loud for you.
Perfect. Yes, I'm on one monitor because I'm not at home, and so I can't see multiple things at once. Oh, oh, it was there. And you got to know that like 99% of the people in this video are related to me, because that's how I do these things. All right, let's try it.
Yo, Rep Dr. D in the house. Let's kick it. Safe sex, baby. Safe sex, baby. All right, stop. Collaborate and listen. Rap Dr. D's rap intention, calling out all your fellas and ladies. STDs are carrying through folks in their 80s. Can you really help being sex kittens? Why can't you wear your little love mittens? Gotta be safe because sex has gotten risky. No shame being a freak and getting a little frisky. Dang, your body's a temple. Even safe's not always so simple. Sex indiscretions lead to depression. No matter who you like, it comes with the best protection. Love it or leave it. Hormones start to flag. Things dry up and your tail comes a wag. If that is a problem, lube may solve it. See your family doc if it doesn't resolve it. Safe sex, baby. Safe sex, baby. Safe sex, baby. Safe sex, baby. Vaginal atrophy is something. A sex catastrophe, it can be the real thing. To the point I'm making lubrications me, and you know I'm not faking trauma. Some guys erections, tear thin skin without protection. Listen up and learn from this lection if you don't want a nasty groin infection. Aging, it's just a normal stage. We all got to get on the same sex page. Fellas on standby, wanting more to say hi. Should you stop? Should you just drive by? Wait till they check at an STD shop. Check things out from the bottom to the top. Your sex life can be later and stronger. Thanks Viagra, boy, parts look longer. Living. A sex revolution. Being sex savvy is the smartest execution. Let's break it down. Cougars all around. All the STDs all the time being found. Bodies. We're just the cafeteria. Set full of germs, virus, and bacteria. What's called a clap? Gonorrhea's got a rap. Sleeping around? Probably a trap. Subtle and sneaky is chlamydia. You may not even know when the bug has got into you. Syphilis makes a painless little sore. Then you spread it around every time you score. All around the scene, back in action. Tear things up, put the parts in traction. STDs are a problem. One way to solve it. See your family doctor. Safe sex, baby. Safe sex, baby. Safe sex, baby. Safe sex, baby. Take heed. I'm an STD poet. Dr. D, I want you to know it. My town. I feed these infections, give bad news when they are detected. Sex can be a germ spill. People aren't safe for real. Virus and bacteria sexually transmitted. How to be safe, make sure the condom's fitted. I'm Dr. G, and I want to help you be free of herpes, AIDS, and HIV. All these STDs really are stealthy. Without them, your sex life will be healthy. No lame excuses. You know to take precautions. Wrap Dr. out. Hope your golden years awesome. If you've got a problem and condoms won't solve it, see your family doc. Maybe they can resolve it.
I'm not sure what happened, Dr. Dowler, but now we can't hear it.
Yeah, we're getting one audio channel, so we're hearing the voice and not the full music experience, which I shared the link in the chat for everyone to view it during lunch or whenever a break, perhaps, for the full music experience.
I mean, right. And it's a great, like, if you're having a boring family dinner, just pull up one of the videos. It will give you all something to talk about. It's, you know, it's there for your enjoyment. And I had several viral video companies that wanted to purchase it, and I wouldn't let them because I said, this is public health. This is public health. So I am in a very dark room now because apparently they're environmentally conscious and I'm not moving. And what are the questions?
Sure. Dr. Dowler, thank you so much for that presentation. I'm glad we got the audio set up for your videos because they are very funny. So we do have a number of comments, actually many comments that are surrounding the video content. Thank you. So I looped the questions into themes. So regarding trends, we have somebody that brought up that the downward shift in trends, they're wondering whether downward trends in cases for youth is also a cultural shift. There is data to suggest less early initiation of sex and teen pregnancy. So maybe teens are just less social, as in past generations. And of course, they've gotten better sex education than the older generations you referenced with that video. So,
And I think there's also the COVID generation, right? Some of these kids didn't get to socialize during those key years when the hormones are going crazy and they were isolating at home and they weren't in school for like a significant portion of time. And like, what are the impacts of that social isolation? I mean, maybe we are seeing a pattern that, in which case it'll go back up again. So we'll have to see if that's part of it.
yeah. We have some other questions, and I think ending with that last safe sex video made me think about this batch of questions we have here. This question is from Lisa and she wanted to know, with so many STIs, don't elderly people use condoms?
Yeah, so generally speaking, what I have experienced is they think of condoms as a birth control method. And so they're not worried about getting somebody pregnant or getting pregnant because of their age. There's also a tremendous amount of reluctance to have those really hard conversations with partners. And so if the partner doesn't offer to bring out a condom, there's less likelihood they're going to ask for it. And so that's just that sort of a cultural trend. But yeah, absolutely not a lot of barrier methods in that population.
Great. Along those lines, asking the hard questions, because that's kind of what we were getting at here with some of your engagement with that community. So what you had a person asking seasoned seniors the hard questions is at times seen as disrespect. So how do we get them to be receptive to the questioning?
It's a really great point. And it's also, I think sometimes it's just really hard. Like I've gotten pretty good at this point in my career to not blush when I'm asking questions, right? I've been doing this for a long time talking about, but I had this older gentleman that I'd been taking care of for 5 or 6 years, and he came in with rectal pain. I had never asked him about his sexual activity. He was just this old grandpa guy that I took care of. Like, shame on me. And I said, well, I have a few questions I need to ask you. With your rectal pain, are you sexually active? And he was like, I am. And I was like, okay, I didn't expect that. I was like, well, are you sexually active with men, women, or both? And he said, men only. And I turned bright red. I don't know why. Like, I don't know what about that moment, but I was like not ready for it. And so there is something different about our elders and how do we communicate with them in a way that's respectful. And like, he wasn't embarrassed. I was the one that was embarrassed. So I think sometimes we put our embarrassment on our patients. And I just tell people, look, these are questions I ask everybody. They're not intended to be judgmental. And no matter how you answer them, it does not matter to me as your doctor. I just need to know the best answers so that I can take the best care of you. And so I think sometimes we put our discomfort in the place of our patients.
Yeah. So along those lines, we actually have a question from Virginia L. And she said, as a physician previously, working in STIs in a specific state and a member of the quote unquote older group, I've never been asked about my sexual health at a medical visit, maybe inclusion of questions in the welcome to Medicare visit. We're always asking about depression, food insecurity, feeling safe at home. And those are very important things, by the way. So maybe adding just one question about sexual health would at least open the conversation. What do you think about that?
I think that's absolutely right. The Medicare wellness visit, like we should be talking about sexual health. The data is there, like that there's infections are going up. We should absolutely work that in.
All right. So we have an inspired participant here, Victoria P. And she's like, I love the idea of sex ed for seniors. And it says, I'm one of the young ones in the community. I'll go see my neighbors and open this conversation with them. Thank you so much for sharing this information, Dr. Dowler.
And I would say if you have a retirement community that's, a vibrant retirement community and that where you live, you should offer to say, would you guys be interested? Now, everyone's not going to show up for it, right? It's a very stigmatized topic, particularly in the older demographic. But those people, even if you got 20 or 30 that came in the room to have the conversation with you, they're going to go back and talk about it at dinner with a few other people who are going to go back and talk about it with a few other people. And you just start having the conversation and normalizing the conversation.
Yeah. We have a question here from Brad C. And they mentioned that sexual health peer education models for this particular population would be really cool programming as an opportunity. So something to keep in mind.
Love that.
All right. We have another question here from Tammy A. I have talked to mature female clients who were positive for STIs about how using condoms and erectile dysfunction is sometimes difficult to broach that conversation.
Yeah, I meant to say that earlier around the condoms, why some of the seniors don't use condoms. If they're already sort of just getting by with their erectile strength and function, using a barrier method can really significantly impact that sexual experience for them and maybe even make it so they can't get an erection. So I think there are a lot of reasons why condoms aren't happening.
And then I just have another comment as we think about ways to tailor our education to the audience at hand. I'm thinking about a lot of the anatomic models we use sometimes to demo different things. They are really catered towards a younger model in general. So this might be the time to advocate for some more mature anatomic models. Maybe you can take them out into the field, test them out.
I love it. I love it. And with, like with hip replacements and,
Yeah, exactly. Yeah. Mm-hmm. Yeah. And we have another comment here from Jamaica L. And right here we have, as a senior health educator with over a decade's worth of experience in sexual health, I believe it's a conversation that has to happen. Education is vital, and it's throughout the whole lifespan, essential to have the same level of respect that we have for our seniors, that we have for all other people, including our teens. And also being mindful of our own biases when we have those conversations. Being inclusive and using evidence-based guidance is very important. So I summarized that very excellent comment by Jamaica. And so I'm happy to take any additional questions for Dr. Dowler. We have a little bit more time. I will say I'm going to reserve some of the detailed EPI questions for Dr. Mobley, who will be joining us back online, and that might be the fair approach to the detailed questions we have here about North Carolina EPI that she can punt to her team. And then I also want to thank you for giving air to the issue that we're dealing with Bicillin. We're seeing these really high syphilis cases in a time when we have a shortage of Bicillin. And from our technical nurse support team that's out there, I dropped a comment in the chat about the current situation. They did a survey to the local health departments about Bicillin, the Bicillin recall. 78 of 86 local health departments responded. 68% of the respondents lost Bicillin stock due to the recall, and 32% of the affected local health departments lost all stock. So it is a big deal that's going on out there. Please look to the provider memo about alternatives. We do have some speakers talking about doxypap later on, but this did come up specific to its use in different populations, for instance, populations with women, female populations, which of course is not the studied group. That said, it might be interesting to see what your thoughts are on doxypap, ways to get that going, papping that up in our older population, and some of the challenges there.
Yeah, I would say that doxypap for me, the classic person is not going to be an older adult. Like we have a lot of younger people that we need to be thinking about doxypap for. But once you've worked it into your workflow and you've got it in your EMR as a drop-down order that makes it really easy for you to put the doxypap prescription in, you've done all the things that benefit everybody, just keeping it in mind for the older population as well. And certainly if you have frequent flyers, like those are the ones that, you're seeing the same fella like a few times a year because he says, gosh, I had an older guy, he was in his 80s, and I saw him every July 4th, the week after, and he'd come in with gonorrhea, and he just treated himself to sex with a prostitute once a year, every year. Like he's the perfect person of, you know what, next time you do that, I want you to take a couple pills, and to save you from having to come in. So just thinking about who are the folks that you're caring for that would be most likely to benefit from it.
Thank you for that commentary. And so we are getting close to time, but I do have a very fun question. And thank you for sharing your lovely personality, pictures of your home, and many family members that are featured in those videos. But I did have a question about your animals, which have very cool names, by the way. As an infectious disease doctor, I can definitely appreciate that. So how has observing their behavior impacted your approach to work, to the topic that you are a subject matter expert on? This is definitely an off-topic question, but as we end this note of this topic with humor, I thought it might be good to ask that this was actually a question that's out there from an audience member.
I love that question so much because animals just have no shame around their sexuality, right? They just like hump each other when they feel like it. And it seems to be largely consensual. I would say with some of my goats, gender does not matter to them. The goats do not care about gender. It makes no difference. I have a boys only club, well, until Benny and Penny. And so it's very interesting how the animal kingdom and sexuality, it is just a part of life and what they are as animals, and not there's just no shame or humility in it. And wow, if only we could sort of get there.
Yeah. On that note, Dr. Dowler, thanks so much on sharing your experiences and your insights. We're going to drop some of those videos in the chat. I think they might already be out there, and play them on loop during our breaks. I appreciate that sharing. And we'll save any additional questions for you to get at your convenience.
Awesome. Thanks so much. It was great being with everybody today.
Thank you. All right. At this time, we are going to turn it over to Lindsay to talk about our break time and when to get us back in line for the next set of sessions. Thank you, Lindsay.